Hi, I'm Peter from Shoes Feet Gear. Today we're going to do a demonstration on how to remove fish hooks from feet and other parts of the body. I just recently got back from 3 weeks on a remote island, and we had a young kid get a fish hook embedded in his foot, and I thought it was pretty timely post to do about how to effectively remove these, save a lot of costs and medivacs and surgical removal as well. So we'll start off with the 3 different situations here. So we've got a fish hook straight through with the tip pointing out. They're not as difficult as they look to remove. We've got one with the tip embedded, and there's a neat trick I'm going to show you to get those out effectively. And then we've got a treble, which is a little bit trickier. So we'll start with the one with the tip out. You want to get the patient lying down. You want they're nice and relaxed and get the body part stable. And then the easiest thing to do is to take the end of the hook off. These aren't the best clippers to use, but there we go. All right, so next thing to do is to take that all the way through. Try and keep everything as still and stable as possible, and come straight out with minimal amount of damage. So the next one is when the tip's in. Some people will take this and push the tip all the way through, but that's going to do further damage to the tissue and the patient. So the best way to do it is to use a piece of pretty thick cord. Normally we'd use one a little bit thicker than this, but this is a very strong 200-pound braid. But yeah, any of the cords like spear gun cord, things like that. And what we'll do is we put the cord around the shank here. So you want to do one loop just so it stays connected and solid. And then the next step is we want to wrap that pretty firmly around our hand, so it's not going to let go through there. So now the trick with this is it needs to be really short and sharp when we do it. So you bend the shank down towards the patient as you go, and then you've got to just snatch it. I'll do a demonstration the wrong way where we just do it gradually, because if you do it slowly, you can see all the pulling and damage and pain that's going to cause. And I'm pulling that pretty firmly, and that's not going to come out. So when it's sitting in here like this with the patient, what we want to do is hold the body part nice and still and solid, because we're going to give this a short, sharp hit. And then as we do that, we're going to press down on this shank. So we're just going to push that down to the skin. That'll move the tip down and the barb away. And then we're going to have slack line and hit it pretty short and sharp and hard, and just pop it out in one hit. So we'll give that a go. So we've got slack line here. We're going to push down on the tip and pop it. So ready? And that's out. All right, so that's a very handy way to do it. I've heard of people going into hospitals, emergency departments, and having that cut out, and there's a lot more damage to the tissue and things like that when it's done that way. So the next one we've got a bit of a combination here. We've got a treble, and we've got the tip out, and we've got one with the tip in. So this one's going to be a little bit tricky to do. So what we might do is, first one we'll just get rid of this one out of the road. So we'll try and cut this one. If we had better clippers, it'd be a bit easier, but we're going to cut that one so we don't hurt ourselves. Get that out of the road. The next one, we need to separate the 2 trebles. So we're going to cut this one further down here. Now, if we had the little sharp snips with a bit more power, we'd be able to probably do that a little bit easier. But that one's not too bad. Now with the one with the tip out, we can pop that one out pretty easily here. Ooh, it's not fully separated. Better cut this one a bit more. There we go. That one's fully gone now. Then we're going to pull this tip out. Trying not to disrupt anything too much, just like pulling out an earring. Then we're left with this last one in here. Now, some people, if you don't have any cord, you've just no option but to bend it through and pop the tip out. Or if you've had to cut it off and there's nothing to tie the cord around, then you just have to push it through, create a bit more pain and just pull it out and get the tip through and pull it out. But we'll have another go with the cord, seeing we've still got that shank attached. So we're going to cord around, one full loop, and then we wrap it around our hand, and then we hold everything still. We've got that locked on. We're going to push down on the shank, and we've got to go from slack to snatch, and we're hitting that pretty much as hard as we can. Just make sure it comes out in one hit. We don't want to go doing it gradually like that, because that's going to create a lot of pain and it's not going to come out slowly. We've just got to snatch it out like a snatch strap on a four-wheel drive. So we've got everything nice and still, ready to go. We're going to press down on the shank and just hit it. So we'll have a go at that now. And we're done. All hooks are out. So hopefully that helps if you've got someone who's around hooks and boats and things like that. I think they're pretty handy skills to know because definitely saved this young lad from getting a helicopter ride and cutting his holiday short, and probably one of his parents as well. So I hope you enjoyed that one. Thank you.